and so that was interesting to have that experience. That the very question about, can you tell us how you've been successful?
The response was in reference to already being evaluated and knowing that their report had come back ineffective.
Gotcha.
So their response was not necessarily your question. So
okay.
We already know that. Just
I got you.
Back the it came back ineffective.
I got you. But I got you. But just use that as an example to say that you know, there seemed to be, and perhaps we'll find that sometimes there appeared to be some level of defensiveness, or it seemed like, well, wow, that question was off-putting, and then my response, I guess, was, it was off-putting to me that question would be off-putting. That's why we refer kids, is for behavior change. So please tell me how effective you are at doing that. So.
When they found out that they actually have to train staff, that they're not delivering the services, doing talk therapy in their sessions, and their justification is that these kids have so many barriers that they face in their communities, they need to debrief. So we spend an hour debriefing the kids on everything that's going on in the community. We spend about 15 minutes on the actual curriculum.
So yeah, so that was part. So part of the reason I asked my question I did earlier about, you know, how much do we engage contracted providers, or how much should you all have done that, is because obviously, you know, everyone is in this work together, and we each have roles, and we need one another, and I hope that everyone wants to improve their services and approaches going forward. So it's unfortunate when we sometimes encounter folks who the response doesn't appear to be, let's all work well together, let's figure out what works best, and let's do that really well, but instead, daggone it, what we do is good, and you just have to want it, and why don't you want to buy it?
Yeah, I mean, we can train POs till the cows come home, but they're still not going to deliver. You know, they're still not going to be mental health experts or substance abuse experts or family intervention experts. I mean, you still need those programs and services. So you need high quality programs and services. Richmond, you have choices. So Richmond, you can walk away. Some of your counties, you don't have choices. You got one or two providers. So it's even more important that you have a high quality program for your kids, right? Because you don't have the choices. Stephanie can say, you know what, you're not willing to do it, go serve somebody else. But I've been to some of your counties and you got one, you know. I mean, we work with a lot of provider networks and do the same thing. We try to train them on the skills and processes. I can tell you from our data, from studies, the more that you share information, you collaborate, effects do go up. Those kind of things do increase it, so what they say is true. But on the other hand, if you've got programs that you don't feel good about, okay? I mean, I've never seen a program, I don't care what model they use, if they do not have, quality assurance. I mean, in other words, if they're constantly, you know, you can't get reports, they don't answer the phone, the director's always changing, I don't care what approach they use, we don't see any effects from it. You know, if they cannot maintain fidelity, then forget about it. So, you don't need all me to figure that. I'm just telling you, don't put them on a behavioral contract, what they're going to do to change, how long it's going to take. Yes?
Oh, I just want to ask you, you know, earlier, I think in your earlier talk, you had mentioned that some of the challenges that POs face, and a couple of them were not recognizing antisocial thinking as well as role playing. And do you think that those are, that we assume that people have those skills and that knowledge, and so they do it automatically, or do you think that there's not enough time to do it, or what are the reasons, you think?
Well, the latter one, I don't think POs, it's ever been part of their job necessarily to role play and to practice. So I think that's clearly a skill you have to be good at, you have to practice. You know, sometimes we're going to start doing some scripts for them, literally writing it out, because some of them, you know, they're challenged. It's really not that hard, especially when you've got the kid sitting there and he gives you the scenario. You saw it in tape. It's perfect. Right? Buddy come over, said let's go out and party. He knew he shouldn't. You know, right? There's your role play. You know, bada bing, it's done. I think the whole criminal thinking piece, though, is I think they're just. I think you've got to train them on that. They've got to be trained to listen. What are they listening for? I always listen for a but. Whenever I hear a but, I did it, but, all right? Now I'm about to hear the minimization, you know? I did it, but I didn't go to school, but here's why, right? And he's got 50 reasons, right? So immediately now you know we've got to redirect that. We've got to work on that thinking, right? So that's part of what I was saying. The YASI, I mean, you got a whole section there on criminal attitudes. You know, a lot of times officers don't understand what they're getting. A good example, I did one time I was up in some state and they used the youthful LSI, the LSI to assess. And I'm looking at these case files, and I had a young PO, and I pulled this one case out, and I said, tell me about this guy. He says, oh, he's the smartest kid I ever had. He had a meth lab, he knew everything about cooking meth. Man, he knew what temperature. And I said, well, what do you think his major risk factor? And he said, well, financial. I said, financial, why is this? Well, he needed money. And I said, well, what do you do when you need money? You cook meth? And he said, no, of course not, you know. And I said, let me explain something to you. I said, this kid's major risk factor is not financial. It's the attitudes and the values and the beliefs he has that say it's okay to sell meth. Okay? I said, if you gave that kid $20,000, what do you think he'd do? Have a bigger meth lab. Right? And here's how I'm looking at the case plan, right? Because he assessed them. Comes out high risk, got attitudes, got all this. But what's his case plan say? Needs a job, check out McDonald's. And I'm thinking, he'll be selling meth out of the drive-through window. The problem, it's not that the kid didn't maybe need a job, but do you really think that's where you're going to start? With somebody who's making $500,000 a week? Right? And now you're going to say go McDonald's for $7 an hour, right? Yeah, I got to get him a job. And that's what I mean by the big four versus the rest of them. Yeah, employment may have been an issue, but that's not the big four. The big four is attitudes, associates, right? Those things. So the PO did the assessment, but didn't really understand what the criminal thinking was all about. So how do you get over it? You train them on it. They got to go. I mean, I can go through the list. There's actually tools out there to assess it if you really want to assess it in more detail. There's ways to do it, but officers need to be trained when they hear that thinking being expressed. You know, they immediately can say, "Well, let's talk about the thinking that you had about that." Right? And you start to do the cognitive restructuring.
I think those are a couple of things we can really be on top of as supervisors too. You know, we review every case plan, so we can certainly have an impact on those and to start changing those and to review them, you know, from the perspective if they're consistent with the assessment and if they're framed around the right things. And then the other thing, you know, kind of getting the ear for the risk factors. I think we can also do so much to, when one of our officers is coming in and telling us about a challenging case, and here's what happened. And so, you know, Vince comes and tells me about this case that he has, and here's what's happened, and here's what the kid said, and what have you. You know, saying things and start using different language and saying, you know, which risk factor is that on our tool? Kind of thing to try to help attach what's going on,
Absolutely.
you know, operationally, what I knew that happened during my day to the assessment instrument. So
I don't want to pick on Richmond, but you're a good example. Richmond, you have programs that target, all right, the second form, right? You got vocational programs, school programs, family programs, recreational programs, substance abuse programs, right? You didn't have a whole hell of a lot to target the big four, all right? I didn't see any cognitive restructuring groups. I didn't see any thinking for a change. I didn't see any of it. It was all around these secondary factors, and you get some effect from that. You know, your programs were average. They weren't bad, right? But that isn't going to get you where you really want to be. Right? You've got to first go at those big ones and then tie the kid into those recreation and those family programs.
Ed, is it your experience that the programs that target those big four are usually offered by the criminal justice agency rather than a vendor?
Usually.
I mean, that's been my experience.
Some exception, but
you know, it's very hard to go find a private contractor who offers a cognitive restructuring group for offenders.
yeah.
It's pretty rare.
It's pretty rare, and some departments, I mean, we've seen this around the country, some departments have just decided they're going to do some of those themselves. Now, in others, they contract. You know, they specifically say, we want you to use this, and here it is, and they dictate it, all right? So some of that we see. But let me